Good evening, everyone. I'd like to welcome you to what we intend to be a helpful webinar discussing leadership and professional development during COVID-19. This webinar is brought to you by Women in Focus Canada in collaboration with the Canadian Red Cross. For those who may not know, WFC is a registered not-for-profit organization with the goal of sharing best and promising practices that promote health and wellness for women, girls, families, and communities in Canada and beyond. Women Focus Canada's mandate includes addressing gender-based violence and trauma, promoting physical, mental, and psychological health, and gender rights and equality for girls and women. It's also about building capacity while empowering individuals to improve their lives and contribute to the socioeconomic development of their communities. Today, we have with us barrister and solicitor Dr. Babalola Johnson, Professor Josephine Etowa, Mr. Sunday Ajao, Mrs. Katie Dilworth, Dr. Kunle Akingbola, and Dr. Zari Gill. For detailed bios, please see the confirmation of registration that you would have received prior to this session. Our guest today will be speaking to us about communication, empowerment, competency development, change management, execution of smart strategies, and team performance in these exceptional times. This series is designed specifically for the Afro-Caribbean community in the GTA, and as always, other communities are welcome to join us in this mission to elevate community awareness, disseminate information, provide education about the prevention, effects, and risks of COVID-19, and provide information on how to access critical services. Without further delay, please help me welcome barrister and solicitor Babalola Johnson. With over 30 years of legal, business, and corporate training experience, Mr. Babalola is the Group Managing Partner at Topmark Attorneys, LLP. He'll be speaking with us today about our pathway to leadership opportunities during COVID-19. Mr. Johnson?
Thank you so much, Nikki, and thank you everyone, and welcome. Let me start by appreciating the Women Focus Canada, as well as the Red Cross for putting this together. This is awesome, and we want to appreciate you for all you're doing. I only have 10 minutes, so I'm gonna have to go through this pretty quickly, and hopefully we will all pick one or two things from the presentation. I'll be speaking about togetherness, our pathway to leadership opportunities during COVID-19. And I'm going to move quickly to the next slide. And basically, this is one of those times, and as we all know, this is a trying time for everyone. But at the same time, when you look at what is happening right now, we have an opportunity to work together and to build each other up and to take each other to the next level, because we are all leaders. That's the way I'm going to be looking at this potentially, and even right now, we are leaders at different levels and in whatever we do. And by coming together as a team and building each other up, we can achieve so many things together. Because at the end of the day, we might think we will be able to do a lot of things alone, but coming together basically will help us to get to the next level. We should always recognize great work, because that helps us. And in coming together, we are building relationships to get to the next level. And next slide, please. I bring it up all the time. It's a very important proverb, African proverb, that says, if you want to go fast, go alone. If you want to go far, go together. At a time of crisis like this, we want to go far. And that's why we all need to come together as leaders and help each other to move forward to the next level. The next slide, please. So I wanted to talk about this, the ancient redwood. So as an analogy of leadership and what we need to do in building each other up at a time of crisis. Obviously, this is a time that everyone is looking up to the other person and asking, how can I help? What can I do? But what can we learn from the ancient redwood? Somebody gave this talk some time ago, and I learned so much from it, and I wanted to share with you. Next slide, please. For those of you who might not be familiar with the redwoods, they are among the oldest living organisms in the world. They can live for more than 2,000 years. Can I have the next slide, please? And they can grow up to 300 feet. They're so tall that their tops are out of sight. Watch this. They can live for 2,000 years. They can also grow up to 300 feet. But look at this. Surprisingly, their roots only extend down from 6 to 12 feet and are approximately 1 inch in diameter. What does that tell us? That tells us that at a time like this, if we cooperate and we work together, if we are well knitted together, among us, there will be those who are weak. There will be those that basically are struggling in becoming leaders. But what we can learn from the redwood is that despite the fact that their roots are very thin and it doesn't go deep enough, they have found a way to work together. And how have they done this? Their roots had intertwined and their roots had fused together on the ground. And this helps them to increase their stability. And it gives them tremendous strength against forces of nature. Remember, different forces of nature will happen when it comes to forests, when it comes to natural spaces. You have storms, you have floods, you have many things happening. But because they work together, because they are intertwined, then they are stable. We can relate that to what is happening today. Basically, we are going through a serious crisis. But as leaders, we have to be able to connect with one another. But in connecting with one another, you should not forget those who are weak and those who are struggling. So you give them opportunities to be able to grow. In my office, one thing we have done over the last few months was to allow the younger lawyers to be able to present in seminars. You sit with them, you support them, you advise. We come together as a team, and we are fused together in helping each other to grow. And that has been of great help to each and every one of us. So you basically allow others to grow by connecting with them and allowing them to be able to feed off you in whatever you are doing. Next slide, please. And the slide after that. What can we learn from the ancient redwood? What we can learn from the ancient redwood are multi in nature. Quite a number of things that we can learn from what I have just shared with you today. Communication. As leaders, we have to know how to communicate properly with each other. You have to communicate with others who are also growing, who are learning from you. Because words can break people. Words can also build people. The way you speak to people goes a long way in them being able to grow in whatever they do. What had happened with respect to the ancient redwood, we believe, is that they communicate properly with each other with respect to how they can support one another. And by doing that, you are building strengths because everyone is now feeding from each other, and then you have support for one another, which is extremely important, because if someone is going to falter as a leader, if they're going to learn as a leader, potentially they will falter. But how do you offer support to lift them up? Equity, because you have the ability to spread the nutrients, you have the ability to support one another. Everyone gains. And then there is healthy competition. At the end of the day, as a leader, every leader has to basically be able to support one another. I understand I have a couple of minutes more. Common goal and empowerment is also very important. Let's go to the next slide, please. The next slide, please. So think about this. As you want to grow yourself in becoming a leader, and as you're also helping others to become leaders, always think about the time that you have had to face some issues personally and in your personal life or professionally. Did you have to face it alone? And by facing it alone, have you learned anything? How did you feel by doing things by yourself without others helping you? So we are better together in growing ourselves as leaders when we come together. That is very important. Can I go to the next slide, please? I have a couple of slides more. So I wanted to share this image with you. If you take a look at the penguin huddle, you can see that they come together. Why? Because it was extremely cold. And what they have done basically would be, if you read about this, they will put the weakest right in the middle. And the weakest is also gaining strength. It's also learning how to be a leader. So the ones that are stronger are at the edges of the huddle. And what happens is that they rotate around to share in the warmth. So at the end of the day, nobody is going to be frozen to death. So at a time of crisis like this, all of us have to come together because we are better together. We have to take care of the weak so that they can grow and become better leaders. And those of us who are leaders already should also be able to hold other people's hands and help them to move up. And that is the essence of us coming together during this crisis and knowing fully well that if we are going to go places, all of us, every race, everyone must come together and hold each other's hands and help each other to grow. And that will be my I think I'm within my 10 minutes. So thank you so much. Yeah, that's a quote, Henry Ford. Coming together is a beginning, staying together is progress, and working together is success. It is my hope that at the end of the day, as leaders and as those who are prepared to grow other leaders, we will start coming together. We will also stay together and work together to be successful. Thank you so much.
Thank you so much, Mr. Babalola. What a fantastic call to action for not just the leaders who are in our audience, but also to those who are aspiring leaders. I love, your analogy of the redwood and how it cannot stand alone. It actually needs a network around it, right, in order to sustain itself. And also the call to action, especially to take a role in leading and also to developing those who may be far behind you. So thank you so much for that. Next, I'd like to invite Professor Josephine Etola. Dr. Etola is a past holder of the Lawyer De Silva Research Chair in Public Health Nursing at the University of Ottawa. She's a senior investigator with the Center for Research on Health and Nursing and the founding member of the Canadians of African Descent Health Organization. We invite her to speak to us today about empowerment through leadership.
Okay, we can move right to the next slide. Thank you, everyone, for coming to listen to this presentation today. Yes. So I would like to actually build on what you just heard about leadership and focus on transformational leadership as a key aspect that we truly need to work on during these trying times of COVID-19 pandemic. And so when we talk about transformational leadership, what are we talking about? We're talking about those leaders who work alongside their team members to identify change and to develop the next action that's needed, the next steps that are needed to actually go to the next level. And those leaders who are capable of transforming others, they can develop and create an empowering environment for others. Now, as we go through these difficulties, we need to recognize those leaders, that can actually create those empowering environments. And it's great that the first speaker actually talked about that kind of environment being created in his workplace. We need to see more of those, especially this kind of leadership, reaching out to others. And I'll talk about why that is so important, especially now. So we need those leaders who are open and they can communicate meaningfully and engage people from diverse culture, and allowing those who they work with, whether you call them followers, team members, colleagues, to freely share their ideas and for those individuals to become empowered by engaging really hands-on in some of those leadership activities. Next slide, please. And so again, transformational leaders are often described as mentors and role models because they lead by their own example. They create an atmosphere where the individuals they work with can openly express themselves. They're actually recognized for thinking outside the box, for making contributions, and from going beyond just the norm that we would normally want to see. And so we need at this time to recognize those thinkers or those leaders, those people in our groups. And like he said, we're all leaders, but we need to recognize those people who make effort sometimes even to think outside the box, because at this time, we do need those people who think outside the box and who can move beyond just being the average person or doing the everyday norm or routine that we've always done. Next slide, please. And so why do we need transformational leadership at this time? I think transformational leadership is needed now more than ever because COVID-19 pandemic has emerged as an unprecedented challenge for healthcare systems globally. This pandemic has exposed existing health inequities, including historically forgotten issues that are rooted in oppression, such as anti-Black racism. And many of the things, or even whether it's in Toronto, in Ottawa, in the cities around the country, we've seen that even in Canada, where universal healthcare system exists, that COVID-19 affects people disproportionately. It's actually just showing what has always been here. And so when you talk about disease conditions, where do I start? I pick on HIV because it's one of the areas that I do research on. People of African, Caribbean, and Black communities represent some of the most vulnerable population in terms of their susceptibility to health risk, the receipt of adequate health care, and even the chances of recovery from some of these conditions. The ACB people, again, account for 25% of the people living with HIV here in Canada, although we only constitute about 5%. In Ontario, it's the same statistics. High numbers of ACB people living with HIV. And the interesting thing is they're not getting tested. They may be going to their family doctors or to other healthcare providers and are not offered even the prophylaxis that is available. Because sometimes people think, oh, I've had people in our research studies who they even asked the person providing care for them, can I have the pre-exposure prophylaxis for HIV? And it's like, oh, you're not at risk. Like they're thinking you have to be maybe men who have sex with men, or you have to be somebody who works, who is not married with a single partner, but we have a number of people. And so we're not actually giving those. So it is these kinds of inequities that truly calls for transformational leadership. Leadership where we can actually address these inequities that has existed, and COVID-19 has only come to expose it, and it's actually giving some attention to the bigger systemic issues of structural racism, anti-Black racism, and how it impacts on all aspects of healthcare, including policies. So effective action on health equity must also include effort to empower disadvantaged communities and to tackle the harmful processes of marginalization and exclusion that is embedded in the hierarchies of power and privilege that is so much part of our country, like many Western countries. So there is an imperative to shift societal values because COVID-19, whether or not we want to shift our values and think differently, COVID-19 is already transforming transforming the way we do business. It's already transforming our agenda. And so we must strike back with transformation. Next slide, please. And I just thought I highlight again, these inequities we see are actually rooted in some unnatural causes. So when we talk about unnatural causes or unnatural inequities, the unequal distribution of health damaging experience is not natural. Instead, it is the result of toxic combination of poor societal, social policies and programs, unfair economic arrangement, and bad politics that creates this. And I'm citing Michael Momo, one of the gurus, global scholars in social determinants of health from the UK. And I like this cartoon that says, you are there in hospital with so many other things in your mind, and they tell you, we've run every test we could think of, and the results show that you're out of money. So you're here because you're poor, and yeah. So next slide, please. And so we need transformational leaders who are capable of thinking beyond the immediate environment, who can think upstream. We need upstream approaches. But that is where the empowerment happens. If we can reach people upstream and begin to get at the issues that impact on people, we would be able to address the bigger root causes of some of the things we see when people show up at health facilities. So leaders need to possess the knowledge, skills, and competence to address upstream issues. These include competencies to formulate, to shape, and influence public policy, and to create system change. It involves the ability to identify the root causes of the inequities, engaging diverse stakeholders like those affected by those issues, and being able to analyze those structural and social and policy issues so that it can be addressed from the upstream before it gets down to downstream problems. Next slide, please. I just thought I highlight again the kinds of qualities we're looking for when we're thinking about these transformational leaders. Because like the first speaker said, many of us see this leadership in young people even around us. How can we begin to nurture that when we see them? Those people that have influence, so idealize influence. Those that have that can stimulate others, the intellectual stimulation, the individualized consideration, those who can pay attention to the individual people around them. They remember people by name. They can talk to them as individuals, not just somebody who works with them, but they understand those people. Even when they have personal issues, they know how to be able to engage those people. And those who have the ability to inspire others, to motivate them to even push their own boundaries to go beyond. Next slide, please. I'm going to take each one of these and so the individualized influence are those people who can exert their influence within the group, so they can actually influence the group thinking. We have some of those. I know in my lab, in my co-create research lab, you can see these kinds of leadership coming up in young people that you mentor PhD students. And how can we nurture that and provide platforms for them to actually shine, to begin to develop those skills, platform where they can actually practice with hands-on mentoring to do those things, especially when we talk about lack of leadership in the health system among the disadvantaged population. For example, the ACP community, where we say they are more affected by COVID-19. Where is their leadership? Are they present in the system? Are they leading some of the initiatives that are being planned, the policies that are being developed to address this? And if they are not at the table, then how are their issues represented at those tables? That is why it's so important at this time for us to begin to see this leadership traits in people and to nurture it and build it. And so we talk about people who are deeply respected by their peers, team, people who have clear vision and a sense of belonging, and they are able to encourage others to buy into the long-term goals of their particular group. These people usually can serve as powerful mentors and role models. So how can we position those who demonstrate these kinds of traits as leaders, even in our small groups, where they can begin to develop those skills. Next slide, please. So intellectual stimulation is another key thing we watch for as we begin to see these young leaders, or even just in our communities, when you're thinking about people who can lead different initiatives. Transformational leaders foster a diverse and open environment where innovative thinking thrives and is aligned with organizational culture. And so we want to bring that kind of thinking. They create an environment where those individuals can push the boundaries and are openly recognized for being able to push those boundaries. These attributes can have positive influence in today's challenging times, where we need more leadership, more representation of people from historically marginalized groups. Next slide, please. Inspiration is another big part. Somebody who can inspire others. So inspirational motivation is a key part because it's necessary to improve performance by raising the team's morale and inspiring those people in the team, followers, team members. That is part of how the transformational leaders get this engaged. And when I think of some of these examples of leaders like this, are people like Nelson Mandela. I remember last year when I visited his prison cell and just walking through the quarry to the area where they went every day to dig this gravel to make paths in Robben Island, and him even thinking that is the first South African parliament, because it was in those quarry where he was digging, he was motivating the other prisoners to keep planning and keep looking ahead, and just inspiring them to move beyond. And you just think, in that circumstance, he was still able to make people to improve their performance, to raise team morale, to inspire them that there may be an end someday. And it's interesting to see that they actually were able to move as a group to become leaders in the free society. So this next, okay, okay, we go to individualized consideration, where this is really focused on a group of people's ability to know the individual at the individual level. Like I said before, they make effort to be able to get to know people in their individual level and the problems that they have. So they coach, they inspire, they empower, and also mentor individual members, not the group mentoring now, but knowing individual members. Next slide, please. And so becoming a transformational leader, this comes easier for some people, but for others, they may have to work at it. And that's why it is important that during these challenging times, we notice the people around us that are already showing some of these. So we need to build these kinds of leadership with the people around us, so that we can be able to have more transformational leaders, especially in our community where we have lack of representation. I think the next is the final slide. So thank you. Yeah. Can I have? No. So in conclusion, I think contemporary issues call for this kind of leadership, leaders who can quickly master complex information, who can communicate effectively, like the other leader presenter talked about, good listeners who are able to empathize and actually stimulate emotion, and also be able to address the issues at hand. So they have to be able to get things done, have to be authentic, open, and confident role models. So with that, now during this COVID-19, it's a very important time in our time to nurture these kinds of skills. So thank you.
Thank you so much, Dr. Atoa. I can't even wrap that up, because I just want people to really take in that last part. I love, the introduction around, transformational leadership as a means of tackling a lot of those issues that have come bubbling up during COVID-19. Thank you so much for that. And wanted to introduce our third panelist or speaker. We have Mr. Sunday Ajao. Mr. Ajao is a tested and trusted human resources leader with over 16 years experience across different industries. Currently a senior implementation consultant with one of the top financial institutions in Canada, he's also the principal consultant at Career Nudge Consulting Inc. Career Nudge is actually a fast-growing human resources firm based in Toronto with services in areas such as HR consulting, career services, educational services, and business advisory. He'll be speaking with us today about change management. Mr. Ajao?
Thank you so much, Ms. Waid. And again, thank you so much, Women Focus Canada, for the opportunity to be here today. Thank you to Red Cross for supporting this wonderful cause as well. So at this point in time, we'll be talking about change management during COVID-19. And most importantly, the previous leaders, they've spoken about how we got to where we are. So I will just go right into what we need to know as a leader when it comes to change management. And more importantly, I would like to talk about what do we do before COVID-19? Because for me, I always like to go from before to where we are now, so we can see the movement of what we need to do as a leader. Can we please go to the next slide? Let's go to the one after this. Okay, so on this slide, I've tried to capture what change management used to be. And like I said, I want us to take a step back as leaders, because for us to be able to know how we need to address the changes that we're going through now, we need to have a perspective of where we're coming from. You know, when we're talking about change, management in the previous world before COVID-19, because now we refer to this time as new normal. Change is something that as a leader, you can have an idea that something is coming your way. As people, you can have the perspective that something is about to happen. And when you're looking at how people perceive change, there are different categories and different ways of how people react to change. We have what we call proactive and positive. These are people that they are willing and ready to move with the change. They are ready to jump on the bus. They are ready to do everything that they have to do just for them to get across that bridge. On the other hand, we have some group that they are reactive, they are negative. They want to challenge everything that happens. They are not willing to change, and they are the difficult type. The third group, we have non-active or indifferent. These ones, whatever is happening in their environment, they don't really care about it. They just want to flow with things. So this is the structure of how we used to manage change management. So now talking as leaders, can we go to the next slide? As leaders, based on what we are going through now, how do we react and how do we manage in the present world? The chart we are looking at now, this takes all through the curve of COVID-19. As we can all remember, when this pandemic started, most of us were in the state of denial. What will happen to me? What will happen to my country? What will happen to where I work? What will happen to my family? And from state of denial, we got into a state where everyone more or less got frustrated, because you can't account for anything. You can't predict what is going to happen. You don't know what the future holds for anyone. Taking a step further, we got to a state that is described as a state of depression. At that point in time, nobody can even control the situation around you. We don't know whether we're going to have a job. We don't know whether we're going to have salary or income to support our families. We don't even know what becomes of the health system. The reason why I'm sharing this page is for us as leaders to know that what do we need to do to get our people, our employees, from state of depression to go over the curve into acceptance. Because as leaders, that is the position that we need to take in these uncertain times. How do we get our employees, the people around us, to understand the realities of COVID-19? What process do we need to put in place? What tools do we need to prepare? What are the ways that we can support the people around us, the employees that we work with, wherever we are as leaders? What can we do to ensure that we get our people up this curve into acceptance stage and ultimately into the commitment curve? Because that is when you can get the best out of anybody that you work with. That is when they can invest their time. That is when they can participate in the community. That is when they can think of how to even better themselves. So as leaders on this call today, I just want you to take a look, look at this curve. This is what we went through during the pandemic. This is what COVID-19 change looks like. So going to the next slide now, and actually the 2 slides up, let's go to the next one. We need to talk in practical sense. How do we get people up this curve? There are some things that we used to do that used to be conventional. But during this COVID time, we need to do them applying different principles. We need to do them with a different lens as leaders. When we are talking about communications, the previous leaders, they've touched on communications. But during this COVID-19, even communication needs to be done in a different way. When we are talking to people around us, when we are talking to our employees, we need to communicate in a way that is applicable to the time that we are in. One thing that is very critical is, as leaders, we have to be intentional and we have to be honest. This is not a time, to cover things up for the people around you. You need to be honest when you are communicating during this time, because as leaders, people are looking up onto you. Your employees are looking up onto you, your families, your community, they are looking up onto you. And what we can do as leaders is to ensure that we are intentional and we are consistent in our approach when it comes to communication. One thing that is critical in the time that we're in now is that as leaders, we need to be flexible. In communicating with the people around you, because I do a lot of, consulting and interacting with organizations. And there's something that we call principles and practices in everywhere that we work. And you tend to see that we hold on to certain things for too long. But in the time that we are in now, as leaders, we have to ensure that we are not rigid when we are communicating with people around us. And very important, we need to listen to our team members. We need to listen to them, because it is in taking feedback that we can do better as leaders, and that we can actually make decisions that will be accurate in this difficult time that we are all in. One other important factor that is critical in how we can manage change during this time is engagement. Somebody, the speaker before me, has spoken about teamwork. We really need to build on this as leaders. Teamwork, collaboration, during this time, we cannot emphasize this enough. It is important that as leaders, we carry one another. It is important that as leaders, we are there for each other. As leaders, we used to say that you have to lead from the front, but with what we are going through now, as leaders, you actually have to be in the moment, with your employees. You have to be in the moment with your community. You have to be in the moment with people around you. And one other thing that we need to do, because again, things have changed. As leaders, we need to be able to set expectations. What do you expect from the people? What do you expect from the people that you are working with? In clear terms, without avoiding ambiguity, causing no confusion. As leaders, we have to be speaking in clear terms now. How are you engaging your people? How clearly are you communicating the expectations and the performance expectations for them? So very important as leaders that we need to understand that in this time that we are in, every little things that we do, we have to do differently, because the time that we are in now calls for a different way of handling things. As leaders, we need to encourage interactions. We need to make ourselves approachable. Can you please go to the next slide? Quickly, I will talk about 2 other strategies that we can employ as leaders when it comes to change management. We need, as leaders, to ensure that we empathize. This is very, very critical. in the time that we are here now, we have to see the people that we work with as human beings. We need to ensure that we place their safety at the core of everything that we do. We need to trust our employees, the people that we work with, the people around us. We need to trust them. When they are working from home, because right now we have too many organizations with employees working remotely, you need to ensure that it's not only when they're in the four walls of the office that they can deliver. Trust your employees that wherever they are working, they are delivering their best. You need to acknowledge their fears and empathize with them. And again, talking about adaptability. As leaders, we need to adapt to the environment we are in now. We need to show trust in the people that we work with. We need to avoid micromanagement. One thing that most leaders are doing now is they are relaxing, the rules on processes, relaxing rules on policies, everything around how you manage people. Relax the rules on business hours, deadline for works. Don't stand on the throne of your employees for them to deliver. Make things easy for them because, again, the times are different. Can we go to the next slide? So just to conclude, because we have very limited time to cover this, it is important as leaders that we need to know that leading is not from the four walls of our offices. As leaders, we have to be visible. We have to show strong of leadership presence during this challenging time. And just to quickly round up, as leaders, we need to know that we have to lead from the front line. We need to build trust, and we need to show compassion to our employees. And very key is the fact that focus on protecting your employees' well-being and lead with purpose. And one thing I know that, just like everyone has said, coming through this unprecedented time, it requires everyone working together. We've spoken about teamwork, we've spoken about engagement. As leaders in our different areas and our different communities, we have to ensure that we work together for us to be able to survive this time that we are in.
Thank you so much, Mr. Ajo. I hope everyone heard what I heard. I heard leading with intentionality. I heard communicating honestly. And I'm going to add with courage, listening to your team, putting the priorities or making the health of your staff first, putting that first. I hope that we're all listening and taking notes. We all know that these are the skills that we need for management, but the key here is it requires a different level or a higher level, during the pandemic. So thank you so much for that. Next, I would like to invite our fourth speaker. I have the pleasure of introducing to you Mrs. Katie Dilworth. She is a chief nursing officer at a large urban health unit. She's the immediate past president of Community Health Nurses of Canada and currently a member of the board of directors for the Canadian Nurses Association. Katie is a nurse with a Master's of Health Science and Health Promotion and certification in community health nursing. She'll be speaking to us today about competency during COVID-19. Katie?
Thank you very much, Nikki. It's an absolute honor to be here tonight amongst such transformational leaders as Dr. Josephine Etwa, Dr. Remy Adwale, and all the panelists here tonight. I'd like to spend a few minutes talking about competencies, a very key element of leadership. But just before I do, I want to congratulate Women Focus Canada and the Canadian Red Cross for enabling this session today to build each other up at a time of crisis. Each of the previous speakers have referred to the importance of teamwork, and what better way than to come together to learn tonight. I'll describe how leadership competencies are integral to leadership during these unprecedented times of COVID-19. Can I have the next slide, please? So, leadership competency, what is it and how do you develop it? Strictly speaking, a competency is the knowledge, skill, or judgment that you need to meet a goal. It's fine to set goals as a leader, but if you can't meet these goals, what's the point? I'd love to give you an example of competency. Let's say you belong to the athletic team at your school, and your goal is to jump over a high jump that is 5 feet tall. In order to be able to meet that goal and successfully get over that high jump, you need the knowledge of what technique is best to get over that high jump. You need the strength to be able to jump that high, and you need incredible judgment of just when to spring up to get over that high jump. Leaders are born with leadership competencies. Are they or are they not? I would say no. You can have all the charisma in the world, and that is not helpful unless you know how to use it. Especially in this time of COVID, leaders need to use their competencies to improve their knowledges. Competencies are important to define because they help us to understand our goals and how we will learn to meet them. All schools use competencies to develop their curriculum and their education system. For example, if you want your student to be able to build a bridge, they need to be competent in math in order to do the calculations to do so. Competencies are created to enable learners to meet these goals. Professional development plans, curriculums for school, whether they be elementary, college, university, no matter. You develop a competency from formal learning, but you can also gain competencies in other ways as well. You can learn from a book, you can learn from a mentor. As long as you have competencies and know what it is you need to learn, you can learn in many different ways. In my world of nursing, nurses use standards of practice to ensure safe nursing practice, but they also demonstrate continuing effort to maintain these competencies throughout their years. Standards of practice provide benchmarks and essential frameworks that guide competency development. Community health nurses, and that's any nurse who doesn't work in a hospital or long-term care sector, have a special standard of practice called health equity. This standard has clear practice expectations for community health nurses to acknowledge inequities arising from power structures, historical injustices, and racism. This standard domain promotes engagement with clients from a social justice, equity, and social determinants of health lens. Given the disproportionate impact of COVID-19, this enables community health nurses to deliver programs, services, and policies that are universal, but with a scale and intensity that is proportionate to the level of disadvantage. Next slide, please. Could I have the next slide? Great. Community Health Nurses of Canada is a professional association of nurses who work in the community. In 2015, they led development of something called Leadership Competencies for Public Health Practice in Canada. This document involved a number of different disciplines. Although it was led by the nurses, there were many different types of professionals that participated, and its very important messages are just as applicable across various different organizations, not just public health. The competency statements in this important document focus around 5 critical areas, including systems transformation, achieve results, lead self, engage others, and develop a coalition. Each of these has very special meaning during COVID-19 and its impact on the Afro-Caribbean community. Transform Our System ensures that public health interventions during COVID-19 focus on the most vulnerable populations. Achieve Results means garnering support for and momentum towards a vision of upstream solutions to mitigate the impact of COVID-19 on our population. Leading self means abiding by ethical codes relevant to practice and demonstrating evidence-informed decision-making and being accountable during COVID responses. Engaging others engenders respect, rapport, and trust. And lastly, developing coalitions includes demonstrating the awareness of the implications of policies, politics, ethnicity, gender, age, socioeconomic status, and religion on health. Combined, these competency statements are helping leaders to know where they need to learn, to engage, and to lead, especially during times of crisis. Could I have the next slide, please? Takes a minute for the next slide to come up. Community health nurses are leaders in their communities, leading clients and leading advocacy for the conditions that can improve health. Community Health Nurses of Canada, their professional association, developed national standards in 2002 with revisions in 2009, 11, and 18 that include a new list of 28 social determinants of health. That includes the social and ecological determinants of health, including Indigenous and Aboriginal peoples' determinants of health. They've also developed public health nursing competencies and home health nursing competencies, along with the leadership competencies. These competencies demonstrate the awareness of social determinants of health on health outcomes and lead engagement with communities to reduce health inequities. These documents and the many other leadership professional development events that they host are changing leadership in Canada. Could I have the next slide, please? Recognizing and acknowledging that COVID-19 is not impacting all communities equally, leadership competencies are one way to improve leadership so desperately needed in these challenging times. This improvement will lead to our programs and services being more universally proportionate, balancing population health and health equity principles in serving our community and contributing to positive health outcomes. Thank you very much.
Next up, we invite Dr. Kunle Akingbola. Dr. Akingbola's intellectual interests focused on the complex interactions in the environment that influence strategic change and human resources management in nonprofit and healthcare organizations. His research also explores the organizational dynamics of social purpose in enterprises. Professional Akingbola is the leading author of the book Change Management in Nonprofit Organizations, Theory and Practice. He has published book chapters and articles in leading international journals. And prior to his academic career, Professor Akingbola actually served in management roles in human resources. He'll be speaking to us today about the execution of individual and corporate SMART strategies during COVID-19. Dr. Akingbola?
Thank you very much, Ms. Waid. Good evening, everyone, and I'm very pleased to be here today. Thank you. A major thank you to Women Focused Canada, as well as the Canadian Red Cross. I'm very pleased to join this very august panel. We'll be talking about execution of SMART strategies during COVID-19. Essentially, the next slide, please. Essentially, I will focus on 4 core areas. We'll focus on the challenges of COVID-19 itself, the impacts of COVID-19, and what are adaptive strategies that individuals and organizations can adopt. And finally, I will wrap up by looking at how to implement the strategies. The next slide, please. In a very, very broad overview, taken from an article I wrote in the Canadian Journal of Nonprofit and Social Economy this summer, I surmise that COVID-19 essentially has 3 broad impacts in society in the short term and in the long term. First, and very importantly, the scale and severity of COVID-19 means that we will have this impact for a very, very long time. COVID-19 is having immediate impact, but we expect COVID-19 to have long-term impact on the way we live in society, the way we interact in society, and what we do in society. Also, COVID-19 will change significantly many of the institutions that support society, the functioning of those institutions that support society. And finally, we are already experiencing it. COVID-19 will change our focus on health and well-being. Regardless of how rich the country is, COVID-19 is questioning the adequacy of what is provided in terms of health and well-being. Okay. Next slide, please. So just to give you an indication, very early in the process, the International Labour Organization reported in April that COVID-19 will result in about 1.6 billion, that's a B, billion workers in the informal economy, almost half of the global workforce losing their livelihood. That is kind of a picture, a gloomy picture of the impact of COVID-19. The next slide, please. So these are some of the specific impacts of COVID-19, the change that COVID-19 will drive in our community, in the country, and across the world over the next decade or more. I don't need to go through it, but just to give you an insight how widespread the implications of COVID-19 would be for all of us. The next slide, please. But very importantly, I want to spend a minute or two on this. COVID-19 means that we're going to develop new assumptions. We're going to develop a different lens through which we're going to see the world, through which we're going to interpret what is going on around us. First, we're going to have to develop a sense or lens of complexity, that there are so many variables at play, so many factors at play, and these factors will impact the way we live, the way we eat, the way we relate to other people, and everything. So we cannot have a sense of, oh, we live in a society and this society is almost an island in itself, that we are interconnected, not just locally, but globally. And many factors are at play at the same time. The other factor is the norm of emergent paradigm, that there are always new paradigm, new ideas. COVID-19 will bring about new ideas in all facets of our lives, and we should expect it, we should be prepared for it. Next, COVID-19 is also going to, and it is already happening, result in increased uncertainty. We don't know what will happen next year. We don't know what will happen next week. I was telling a class last week that if someone knew this time last year that the world, almost the entire world, will be restricted in one way or the other, the person will be more than a billionaire now, because no individual in the world could have predicted where we are today. So there is increased level of uncertainty. As a result, we have to depend on one another more. We have to build network. The next slide, please. Here we are talking about strategy. So what do we mean about strategy? Let me just spend less than a minute to describe what we mean by strategy. People often construe strategy as something like an end in itself. Strategy is actually a process. What is the process of getting from point A to point B? What tools do you need to implement? What resources do you need in order to implement the tools? So strategy at organizational level can involve efficiency, gaining competitive advantage, using your competitive advantage to achieve a specific substantive vision that you have. So it is a tool that you use to actualize the mission of your organization. But very importantly, strategy involves matching challenges with the opportunity that you have at hand. So as much as COVID-19 is a major, major challenge that affects all of us, it is also an opportunity. So for us to look at strategy, to use strategy to look at COVID-19, we have to understand COVID-19 as a challenge, but also as an opportunity. And some of the information I will be providing very briefly tonight will involve how do we execute an effective strategy to position ourselves, whether as individuals or as organizations, to maximize the opportunities and minimize the challenges of COVID-19. The next slide, please. So at a very, very broad level, I am proposing this adaptive strategies. It is very, very broad. It is at a very, very high level. For every individual, for every organization, there is a need at a starting point for a plan. What is our plan, not only to survive COVID-19, but a plan to position the organization to flourish, not just to survive, to flourish, to be successful beyond COVID-19. A second element is to build or reinforce network. You remember from the assumptions we reviewed just a minute or so ago, a key element of the future society that started now as a result of COVID-19 is network, is interdependence, it's connection. So we have to build or at the minimum reinforce the network that we have now. The third element is to develop the element of self-leadership. For individuals, this is very important. People often construe the idea of leadership to be something that is hierarchical, it is a position. And all my esteemed speakers today, each one actually has explained that leadership is not a role, is not a position, is not a trait. It is a skill. It is a competency that you develop. So the organization at the broad level must develop leadership, but individuals within the organization, individuals in their own life must develop self-leadership, ability to work towards a vision, ability to motivate other people, ability to generate resources to support the goals of the organization or of the leader. Then finally, in this broad adaptive strategy, you need to implement and evaluate the plan. It's one thing to have a plan. It's another thing to know how to evaluate the plan that you've implemented. By evaluating the plan, you can determine what is working in order to add more resources, correct what is not working, and start the process all over again. The next slide, please. So I've broken this down more to the individual level. So I'm using a scenario to describe what it means to execute a strategy. First, you have to define the time frame and scope of your strategy. How long is this strategy for? Typically in organizational life, we develop strategy for either 3-5 years. Operational plans, we develop it for 1 year. So you can develop a plan, say, oh, this is what I want to achieve within 1 year. During COVID-19, we're still within COVID-19. This is how I'm going to effectively survive COVID-19. This is how I'm going to stay safe if I'm in my job. This is how I'm going to flourish and be successful in my job. This is how I'm going to position myself for opportunities that are coming in my organization during COVID-19. And those opportunities that are coming beyond COVID-19, where is my organization going? So you are developing the time frame. You are also developing the scope of your strategy, because a strategy without a scope is essentially walking in the dark. There is no direction. There is no limit. Secondly, you have to identify the major stakeholders. Who are the stakeholders? Who are the important players in the strategy that you have developed? You remember, you need a network. You can't do this alone. So who are the important players? Who are the collaborators? Who are the facilitators that you need to work? Who are the mentors, even in some cases, to help you to actualize the goals of your strategy? Then the next stage, you have to identify the basic needs. What are the basic needs? Beyond this plan that I've developed, what are the basic needs or the basic resources that I need to actualize the plan that I'm putting in place? Also, you need to identify the key constraints. What are the challenges? Because you cannot have a plan without trying to articulate or understand the challenges that you will encounter, and develop mitigation plans in order to overcome the strategies that you are going to implement. And based on the plans you have to construct a scenario. What is a scenario? What ifs? What are the what ifs? If this doesn't work out, what are the contingencies I have in order to address the loopholes in my plan? So you have to go through scenario planning. What is the worst case scenario? What is the best case scenario? Okay. Next slide, please. As part of developing an effective strategy, you need to evaluate your assumptions, because every strategy has an underlying set of assumptions. So key part of the plan is the plan itself, but also is important to go back to ask yourself about your assumptions, your fundamental assumptions. Are your assumptions reasonable? For example, now you can forecast, when will COVID-19 come to an end? Are you looking at a year? Are we looking at 2 years? Some people have indicated that by the end of spring, this should be over. And some people have said that COVID-19 will effectively not be over until another 3 to 5 years. So you have to ask yourself about the assumptions you use in creating your plan. And you have to look for evidence to support the assumptions or debunk the assumptions. So what are the important points that you've included based on the assumptions that you have? And as I said earlier on, have you considered contingencies? What will happen? What is likely to happen? What if those things that you've included in your plan as key assumptions do not happen? Then have you focused a lot on specific areas and you've ignored some areas? And what are the impacts of overemphasis on some areas without even considering adequately some other areas? The next slide, please. So this is just to reinforce the key point of the broad strategy. You are, after considering your assumption, you are looking at what are the important points, going back to the strategy that you've developed. You are connecting and linking plan to clear goals. You are setting boundaries and engaging people. You are getting support or developing support and building resources. And you're managing and tracking progress in your strategy. The next slide, please. And now this will be my last slide. I have a minute to go. Strategy, effective strategy, both at an individual level and at an organizational level, involves a key scenario, the plan for contingency. And the scenario I will give you to end the presentation is, just think of building a shed in your backyard. You have a well drawn out plan to build a shed within 5 days. You have your resources ready. You have a timeline. You've taken away time away from work, and you have 1 week to complete the shed. On the first day, a major storm that was not in the forecast came about, and you were not able to do anything. So you already forfeited 1 day. The second day, when you started working, things worked out, and you basically completed about 30%. On the third day, you lost your dog, and you have to spend half the day looking for your dog. And at the end of the 5 day, you were able, 5 day you set apart to complete this, you were able to complete only about 40% of the project. And that is the reality of strategy. You plan, but it is very important to develop contingencies in order to address issues that are unplanned. Thank you very much. And that's the end of my presentation.
Thank you very much, Dr. Akingbola. Our next speaker says, and I want to read this verbatim. She says, "I help young leaders who help the world." Those are the words of Dr. Zari Gill, who is a global health professional and social entrepreneur with over 25 years of experience in 30 countries. She is passionate about futuristic thinking, personal innovation, and spearheading learning initiatives. Her message and stories for change and developing personal impact come from the people she has met, communities she has served, and experiences she's gained. I invite Dr. Zari Gill to speak to us today about effective leadership during COVID-19. Dr. Gill?
Thank you. Thank you so much. And to each one of you for sticking out up to this time, and to each of one of our speakers. I'm very grateful to Women Focus Canada to invite me to be part of this very influential and effective webinar that we are here to talk about. So we have heard a few things about COVID and what's happening in the world, especially our last speaker. But I want to focus on a few things about it, and let's just reiterate a couple of things, and that is that COVID has crossed all borders. Whether it's the most developed or the least developed nation, it has immensely impacted and adversely impacted everybody. And now that we are looking at, the communities, where we see that despite the average differences, the characteristic differences in people in those countries, the effect was more immense and more drastic in the communities which were Afro-Caribbean communities, the Asian communities, and other minority groups. And worst of all, the women and girls in these communities have been worst affected. Their lives have been changed. And sometimes we are not afraid to say that these changes may be permanent, and we just heard about it as well. So we are here to talk about the leadership and professional development during COVID-19 pandemic, and I chose to talk about the intracultural change that needs to take place. We will be hearing a lot about strategy change, policy change, and systemic change, which needs to happen. But I choose to talk about an intra-cultural change led by women and girls from these communities who can rise up and lead. Next slide, please. So Coco Chanel, a well-known name in the fashion industry, she was a woman who was indifferent to the norms and expectations in her times. She chose to wear trousers. And her designs, which have become the classics now, the woman's suit, the costume jewelry, the little black dress, are norms, which were brought in by Coco Chanel and have changed women's fashion industry undeniably. Amelia Earhart, the first ever female aviator who was committed to doing what was close to her heart. She was the solo transatlantic flight. She took it across the Atlantic, And then she started an organization which helped other female pilots to be more organized and to be supported, which we see up to this day. Malala Yousafzai, a very young person, youngest actually, the Nobel Prize laureate, who was shot in her head because she talked about girls' education in a very conservative society. She now lives to see that all girls will get education. And my favorite, Maya Angelou. Maya Angelou lacked college education, but she was called Dr. Angelou. She wrote books and prose and poems and memoirs, which changed the society. She showed through her writing that love for literature and for change and for building character can actually help us face racism and trauma. Next slide, please. So we have seen that in the past, whenever there have been sinister times, desolate times, difficult times, there has been a demand on women to rise up and lead. And these were just a few women I mentioned who rose up and led and brought about undeniable change in the world, which we can see up to this day. So now, as we are talking about leadership and development during COVID and also inching towards COVID-19 recovery, I choose to talk about the change that can be brought about by women, and change starting at personal level, at intra-cultural level. And if the time is calling on us women, particularly young women, to rise up and lead. Next slide, please. So to be able to rise up and lead, you have to be ready, right? So there are three things to do, and that is to start, use, and do. So next slide, please. So the first thing is start with who you are and from wherever you are. So you could be a very young person or a very experienced person. You could be single or with family. You could be a manager, a VP, or you could be working in the customer service. Wherever you are and whoever you are, you need to start to rise up and lead. So I want to tell you a story. You may have heard about it. Mel Robbins, it's her story. So she was really badly affected and devastated by the financial crisis they were facing. So she came to a point where she could hardly get out of her bed. She was just, unhappy and so tired all the time and could not make herself do the things that she wanted to do. She wanted to do them, but she could not make herself do them. And then you can read more about her. There's a lot of material out there about her story. So one night actually, she was watching some TV, and then there was the rocket launch happening. And so she's just sitting there watching it, and then there's the backward counting. So it goes 5, 4, 3, 2, 1, and boom, and the rocket is launched. And you know what? Mel found herself standing up by the end of 5, 4, 3, 2, 1. And that's when she realized that it's the power of now that puts you into action. So next morning, when the alarm went on, she, instead of putting it into snooze mode, She counted backwards, 5, 4, 3, 2, 1. And before she knew, she had shot herself out of the bed and she was ready to go. This is Mel Robbins' story. But I assure you, you have a story as well. So tonight, take a piece of paper and a pencil or pen, whatever, and write down the times when you felt immense joy and happiness over the last 5 years. Write down the instance when you were strong, when everything around you was going wrong. Write down the time when you stood by your principle and you showed grace and poise when it was most hard to do that. And write down the instance where you were able to move the mountain. And there you are. You have the outline of your story. Next line, please. So, practice the power of now. Start counting backwards if you have to. 5, 4, 3, 2, 1. Rise up and lead during COVID. Lead at your family level, lead at your community level, lead where you might be taken. Next one. The second thing I said we needed to do was to use what you have. So we have our hearts, our minds, our personalities, our character, our charisma, our gravitas. These are the inborn gifts that each one of us has all the time, everywhere, any place we go. And you know, you can call on them on demand whenever you need. Whenever you are in need to show and to use, they are there for you. Next slide, please. So top up these inborn gifts with a few other things, 3 things basically. The first one is time. Time for yourself. That is the most important gift you can give to yourself, because this is the time when you rejuvenate, you re-energize, and you fill yourself up. So make a combination, whether it's gardening, relaxing to music, going to the spa, going to the shopping, for example, or prayer, or sitting down and reading. Make a combination of all these activities and take about 2 hours a day for yourself to build up yourself, to make yourself stronger and more energized. The second most important gift is the gift of freedom of choice. Viktor Frankl has said that the freedom of choice is a gift that nobody can steal from you. So make the choices wisely to use your gifts to the effect of yourself, influencing yourself and to others. And the third important gift is your story. You know, the outline that we were just talking about? Start growing your story. Start nurturing your own story. Earlier, we heard the example of the redwoods. And same is the example for cedars, because I love trees too. So cedars and redwoods, they all grow tall. And we heard the taller they are, the wider is their root network. So grow your story, nurture your story, and make it grounded and sound within your own family and your communities. Next slide, please. The third important thing that we want to do to rise up and lead is do what you can. So here I want you to look at the example from the tightrope walker. Maybe you have seen one in your life. If you have not seen one, then please look it up on the YouTube and watch it. So basically what happens is that there are 2 poles and a very tight rope in the middle. The 2 poles on the ends provide the intrinsic balance. And then there's another pole which the tight walker holds in her hand as she walks across the tightrope, which gives her control. So the first thing that I think that we need to do is to identify those 2 poles which will provide you the intrinsic balance, and the pole which will provide you self-control and self-leadership. Once you have identified these poles, whatever they may be, a person, or it's your own prayer, or it's your own self-reflection, or it's reading, or it's another resource that you would need, whatever it is, when you have identified them, the next step is to make space. Identify and check off the things that are taking you away from your story, to put your story into action, I mean. Things that will color your story, a tone too dark or a tone too light, because that will change the action in your story as well. And the third important thing is flexibility. Keep your story flexible, will also make it supple and more invigorating and more engaging for the people. Once you have done your story, you have the power, the intrinsic power of influencing yourself and others. Next slide, please. So do it the best possible way. Do it in a way which is the top notch, the best that you could have done. And as Maya Angelou said, do the best you can until you know better. And then when you know better, do better. So these are the few things that I thought would bring us to the point where we can understand our own self, our own story, our own influence, and how to bring that change as we recover from the COVID impact on our lives. Thank you so much for your time, everybody. I would love to hear your stories, so stay connected. And I'll be, I don't know if there are any questions, or there's time for questions. But thank you, everyone, and have a good night.
Thank you so much, Dr. Gill, for that. I actually wrote it down because I have to always remind myself, where was it here? Sorry. Do what you can in the best way that you can. I love that. Thank you so very much for all your words, and also for highlighting, those women who have took it upon themselves to be the change for us, right? So thank you so much for that, Dr. Gill.